Ready for your appointment, Granny?
Yes, darling, just a second. I'm having trouble getting out of bed. It's like this every time I need to stand up. I can barely walk without this cane. It makes me so slow. Walking around is so hard these days.
Hello, Granny. I'm Doctor. What brings you in today?
I have a terrible tremor in my hand. I've also been extremely constipated, nauseous, and dizzy. I have no appetite, am rapidly losing weight, and have trouble remembering things. Granddaughter, I seem to have forgotten your birthday.
Granny, tell the doctor about what we talked about earlier.
My husband thinks I should get adult diapers because I have trouble going to the bathroom. I've been struggling with falling asleep and staying asleep because I'm so anxious. Plus, my arms and legs are stiff and in pain.
I'm a neuroscience student, and it sounds like Parkinson's to me, Doc. It's a neurodegenerative disorder that affects multiple systems of the brain. It says the causes are mostly unknown, but probably a combination of genetic factors like mutations in the PARC genes that mutate alpha-synuclein, and environmental factors, since familial Parkinson's only accounts for 15% of cases.
We still need to confirm with further testing. Granny, please write the sentence, "The goose walked across the road." Micrographia is a symptom of PD. Have you noticed any loss of smell, Granny?
Yes, I can't smell my husband's cooking anymore.
Oh yes, I read that Parkinson's causes hyposmia.
Interestingly, there is more dopamine in the olfactory bulb of patients with PD, but since these receptors are inhibitory, the abundance of dopamine is actually suppressing functionality.
How does this loss of dopamine cause tremors and make it difficult to walk?
There are dopamine neurons in the part of your midbrain called the substantia nigra pars compacta. These neurons signal cells in the basal ganglia. When there aren't enough dopamine neurons in the substantia nigra, there isn't enough signaling, causing your symptoms of bradykinesia, rigidity, and tremors.
What the heck happened to all my dopamine?
Although the cause of PD is still unknown, we do know the symptoms are caused by cell death and intraneuronal Lewy bodies. One pathological pathway is oxidative stress associated with mitochondrial dysfunction.
What's oxy-whatever stress?
Oxidative stress is an imbalance of oxygen-reactive species, or free radicals, and antioxidant defenses, creating a toxic cell environment.
That is correct, granddaughter. Another theorized contributor to PD is proteolytic stress, which is an accumulation of cytotoxic abnormal proteins. This is caused by a malfunction in the enzymatic breakdown of these proteins. The third mechanism is local inflammation, mostly as a side effect of the actions of glial cells.
But what about her other symptoms?
There are non-dopaminergic neurons in the midbrain affected by the disease, including loss of serotonin and cholinergic neurons, which are implicated in REM sleep disorder. This loss disrupts the normal atonia that occurs during REM sleep. Though we see neuron loss in Lewy bodies throughout the CNS and even PNS of patients with PD, the disease is highly selective in which neuron groups it targets. This is why PD rarely causes severe cognitive loss.
Is there anything you can do?
Unfortunately, there is no cure for PD. I can offer you a few treatments that will help with your symptoms, including surgical intervention if your symptoms become too severe. The most common medication is levodopa. Levodopa, or L-dopa, is an amino acid that is used as a precursor for the synthesis of dopamine. Levodopa can cause nausea, so it is usually prescribed with carbidopa, an anti-nausea drug.
Levodopa sounds right for me.
I'm also going to recommend you increase protein, vitamin C, and E intake along with physical therapy to get you moving and out of the house.